Let's just cut to the chase and dive straight into the unvarnished reality of hair transplants. If you've ever considered this procedure yourself, or maybe you're just kind of curious about what actually goes on behind those flawless before and after photos, you know there is a ton of misinformation out there. So in this explainer, we're going to completely clear that out. We'll be walking through a really candid case study of a highly active fitness personality, looking strictly at the hard data, the medical timeline, and the brutal physical demands of recovery.
To really grasp what this procedure demands of you, both physically and mentally, we're going to break this explainer down into 5 chronological phases. Inside the surgery room, the strict post-op rules, training during early recovery, medications and hair care, and finally, the full recovery timeline.
All right, let's kick things off with Phase 1, inside the surgery room.
Our case study provides a super clear picture of the sheer logistics involved here. A standard overseas procedure, usually in a high-volume hub like Turkey, can cost you around $3,800. But listen, financially, that is just the starting line. Physically, it's an absolute endurance event. We are talking about sitting there for 6 to 8 hours to harvest and place anywhere between 3,000 and 4,500 individual hairs. Luckily, the patient is usually heavily sedated, so you're essentially just sleeping through the bulk of this massive marathon.
Now, you might think every single hair they place is guaranteed to stay put, right? Well, biology has its own rules. The front of the scalp retains up to 95% of transplanted hairs simply because there's significantly higher blood flow up there. But the crown area? That might only retain about 50%. Because of this pretty stark difference, patients almost always have to mentally and financially prepare themselves for multiple surgical visits just to get the crown looking right.
And here is a huge misconception. The absolute worst, most agonizing part of this entire ordeal is not the extraction. It's not the implantation or even waking up afterward. No, it is the initial freezing of the head. The local anesthesia injections required to completely numb the scalp before they even begin are universally described as immensely unpleasant. I mean, once your scalp is frozen, the sedation takes over and you're good, but getting to that point is really rough.
Which brings us to Phase 2, the strict post-op rules.
This is exactly where standard medical advice fiercely clashes with a highly active lifestyle. See, the clinic's orders are exceptionally cautious. 0 lifting, 0 cardio for 1 full month, and that's entirely to keep your blood pressure down. But for an athlete who's used to training literally every single day, a whole month off is a massive psychological hurdle. In reality, our subject just couldn't last the month, so they made a practical compromise to start some heavily modified cardio and lifting after just 7 days.
The reason clinics demand this extreme caution is simple, and our source uses a totally perfect analogy for this. The newly transplanted follicles are incredibly vulnerable. Think of it like taking flowers right out of the ground by the roots, moving them, and then gently putting dirt over them. Those roots need about 10 solid days to lock in. If you spike your blood pressure doing heavy exercise before those 10 days are up, you literally risk pushing those flowers right back out of the dirt.
So moving into Phase 3, training during early recovery.
How do you actually train without uprooting the garden? Well, after a grueling first week of absolutely 0 activity, our subject carefully introduced Zone 1 cardio on day 8. We're talking keeping the heart rate at a very low 109 beats per minute, basically just a brisk walk to burn some calories without spiking blood pressure. By day 12, they returned to lifting, but with extreme caution. They were leaving about 5 reps in reserve and cutting their set short to keep their heart rate strictly under 120. Finally, by day 17, those follicles are locked in and you are officially out of the woods.
To further mitigate stress, our subject took a really fascinating, highly specific step. They deliberately slashed their hormone replacement therapy dose from 140 milligrams down to just 60 milligrams a week. And honestly, the logic here is brilliant. Why keep testosterone artificially high to support heavy lifting when you're purposefully sitting around trying to heal? By letting their hormone levels drop during this sedentary window, they reduced overall physiological stress. They willingly sacrificed a bit of muscle just to ensure the transplant was a total success.
Next up is Phase 4, medications and hair care.
Once those follicles have finally solidified, your focus shifts heavily to long-term pharmacological upkeep. You're basically building a chemical toolkit. You've got oral monoxidil to promote overall retention, and 6 milligrams of topical GHK-Cu copper peptides for scalp healing. Interestingly, you can't just slap that peptide on immediately. You actually have to wait until around day 11, once the surgical scabs finally fall off, to use it. And finally, there's finasteride, which is an oral medication used to block DHT. That's the primary hormone responsible for hair loss in the first place.
But we really need to take a closer look at that last medication. While finasteride is absolutely the gold standard for blocking DHT, it comes with some very real risks. Roughly 5% of users experience severe complications. In this particular case study, our subject experienced severe sexual side effects while taking a 5 milligram dose. Faced with that reality, they made a definitive choice. They stopped the medication completely. They stated they would much rather face potential hair loss down the line than live with those side effects. It's a stark reminder that post-op care is a very delicate balancing act of risk versus reward.
Finally, let's zoom out to Phase 5, the full recovery timeline.
So, you've survived the surgery and navigated those tricky early days. When does the mirror actually reflect the results you paid for? This 4-step macro timeline is absolutely vital for setting your expectations. Step 1 is solidification around day 10. But Step 2, this is where patients have to mentally brace themselves. It's the infamous week 3 shedding phase. This is where the newly transplanted hairs actually fall out. Let me repeat that. They fall out. You will temporarily look much worse than you did right after surgery. But don't panic, it's just part of the process. The roots remain safely beneath the skin, and permanent early regrowth finally kicks in around months 3 and 4, with your finalized result taking anywhere from 6 to 12 months to fully mature.
As we wrap up this explainer, I want to leave you with a fascinating philosophical debate that was raised directly by our case study. You know, critics often argue that modifying your body signals a deep lack of confidence, but the counterargument is equally compelling. Whether it's getting a hair transplant, wearing makeup, fixing your teeth, or even just hitting the gym, does it show a lack of confidence? Or is it simply a highly confident choice to take control of your reality and how you present yourself to the world? It's a question definitely worth pondering as the stigma around these procedures continues to fade.